As we begin, may I ask everyone to put their name, title, and email in the chat? And just a reminder that this meeting will be recorded. For the new members, my name is Racine Droz, and I work for City Harvest as a Senior Director of Operations, and I co-lead New York City VOAD with a very familiar face and name and a strong leader of the disaster world, Zach, from Salvation Army. And our Vice Chair, another familiar face, name, and strong leader, Io Harrington from the Lower East Side, LES Ready. We have some exciting speakers today. We have Cari Olson from the New York City Department of Health and Mental Hygiene. We have Caleb Smith from We Act. So without further ado, Cari will be discussing with us on how our communities can keep safe during the summer. After her presentation, we'll be opening up for Q&A. So a little bit on Cari's background. Cari is the Assistant Commissioner of the Bureau of Environmental Surveillance and Policy at the New York City Department of Health and Mental Hygiene, where she's worked for nearly 20 years. The Bureau's multidisciplinary team works to influence our environmental health policies and programs through innovative health surveillance, legislative and regulatory action, and informatics across topics ranging from air quality to climate health. Cari and her team led multifaceted efforts to combat the health impacts of climate change via public policy, community resiliency, and healthy housing initiatives, including efforts to address energy insecurity. So I'm going to just hand it over to Cari.
Wonderful. Good morning, everybody. It's a real privilege and pleasure to chat with you this morning. I'm going to share my slides quickly, so please bear with me for a moment. Okay. All right. Can you all see my slides and is that working? And please say something because I'm a little...
Yes, you can see.
Okay, great. Oh, and I found you all as well. So great. So I'm really happy to have a conversation today with a group of community organizations that are already dedicated to really thinking about ways to keep our communities safe and ways to support communities. And I'm going to specifically focus on how we can be thinking about this during the heat in the summer. I'm going to talk about climate change specifically and how it relates to the heat. To set the stage, talk about health impacts and staying safe. I'm going to talk a little bit about power outages, the Home Energy Assistance Program, and then community resiliency. So just a little setting the stage here. Climate change, we know is already upon us. So this is not something we're waiting to happen. It is already happening. And we are seeing that the increasing temperatures, the extreme weather events that come with climate shifts are already stressing our systems, our communities, and individuals as we do our best to lead healthy lives. The graph here is from the New York City panel on climate change. Their report in 2019. They have another one that's coming out soon. And what they have shown is that we expect heat waves to be increasing dramatically in our summer months. And we see overall increasing temperatures in the summers. We're going to have more extreme weather events of other types, inland flooding, these types of things. And while the emergency response aspect of this is incredibly important, and I know is a focus of this group, we also really need to be thinking about how we can move as a city toward adaptation and really resiliency at the community level and at the hyperlocal level, in addition to thinking about systems. So some of the facts around our rising temperatures. We know that because of the urban heat island effect, New York City can be up to 10 degrees hotter on average than surrounding areas. We also know that our summer temperatures are very much becoming hotter and more humid than they have been in the past. So over the past decade, we have seen that temperatures are actively increasing and are much hotter hotter than they were previously. And we know that extreme heat, it's often called the silent killer because it doesn't make quite the same sort of visual and sort of physical impact that we see from, for example, a hurricane or flooding events that also do incredible damage to infrastructure. But it is killing more people in the US and in our city than any of these other extreme events do. And in fact, if you combined them, just as an example of that, we're all very aware of Hurricane Sandy and the toll that took on our city, both infrastructure and for individuals. And approximately, I believe it was about 52 people died directly from Hurricane Sandy, and about an estimated around 100 excess deaths occurred due to that event, which was a huge deal and something that we are continually thinking about how to prepare for. And what we also know is that every summer we have 350 people who are dying related to heat in our city. So we need to be thinking about and preparing for all of these things. And heat is very much, even though maybe we don't think of it first, is very much part of what we have to be preparing for. So how hot is too hot? We know in New York City that the risk of illness is greatest when we are in a heat emergency situation. So that's when the National Weather Service issues one of their heat advisories. And we're very fortunate in our city. We were actually the first city or place in the US that had a revision to the National Weather Service thresholds for a heat emergency based on health impacts. That happened back in 2007 based on work here at the health department. And what we found was that when the heat index, which is that combination of temperature and humidity, when that hits 95 degrees for 2 days in a row, then we start to see this exponential increase in the number of deaths due to the heat. So the threshold, which is here on the slide, is 2 or more days with a heat index of 95 degrees up to 100. And then if we have 1 or more days that have a maximum temp of heat index of 100 degrees, then there is a heat advisory. But it's also important, as I was sort of alluding to previously, to remember that even those hot days short of a heat wave are also dangerous. We actually know that there are more 90 degree days now than there were 10 years ago, and we're seeing a steady increase in those hot but not yet extreme temperatures in our city. And we also know that more New Yorkers die from heat on hot but not extremely hot days, because if you think about it, even though the risk is much greater on the heat wave days, there are many more days that are hot but not yet in that advisory level. So this is one of the reasons that we really emphasize and are excited to work with groups like you all around how can we be thinking not only about the response in the emergency, but what should we all be doing together to make our city as safe as possible throughout the year and throughout the summer. So the good news is that all heat-related deaths are preventable, right? Heat-related deaths are due to an exposure, and if we can avoid that exposure, if we can keep people cool in the heat, then we can avoid these deaths. There's an average, as I mentioned before, of 350 heat-related deaths every year. We have an annual mortality report for heat-related deaths that the health department puts out every year, and I'll stick the link in the chat, and I can also share these slides if people want them through the colleagues that organize this. And so we look at heat deaths 2 ways. So one way is looking at heat stress deaths. So this is where it's written on the death certificate that somebody has died of heat stroke. And there's about 7 to 10 of those each year in New York City. So that is just the tip of the iceberg, because most deaths occur when the heat worsens an existing health condition of some type. And so we look at these through modeling in order to understand excess deaths. So how many more deaths are occurring because the day is hotter. We also see increases in emergency department room visits and also hospital visits for lung, heart, and kidney disease. And I'm going to walk through the risk factors specifically for heat-related deaths. But one thing that I also want to emphasize is that we know that there are greater risks to Black New Yorkers, and that is directly related to structural racism, which is driving inequities in our city and across our nation in housing, energy, access to healthcare, and economics, all of which benefit white people while disadvantaging people of color. And as a result, we see 2 times higher rates of heat-related deaths among Black New Yorkers compared to white New Yorkers. And I know that Caleb is going to be talking more about the sort of implications and environmental justice impacts and approaches to heat as well. So in New York City, what we see is that the primary risk of death is actually indoors. Most of the deaths due to heat are happening in homes that do not have air conditioning. And one of the reasons for this is that we know that if you do not have cooling in your home, that the indoor temperatures can actually be much, much hotter than outdoors. And they also remain hot. So one of the things that we see when we look at mortality from heat is that the impacts are not just on the day of the extreme heat or the hot day, but they lag or linger for up to 3 days after that extreme heat event. And that's because those indoor spaces that haven't been cooled remain hot. It's also really important to note that fans are not enough when we talk about really hot weather. We need to be providing people with access to air conditioning if at all possible. We also look at neighborhood level heat vulnerability. I'm not going to spend a lot of time on this because Caleb's going to talk about it as well, but this is our heat vulnerability index in which we look at both social factors and environmental factors that together predict or show where we see the greatest risk of heat-related mortality at the neighborhood level in our city. And we can use this type of information in order to help focus and prioritize our interventions in the neighborhoods that need it the most. So who's most at risk? So I'm just going to keep saying this over and over again. So I apologize, but the biggest risk factor is not having or for some reason not using air conditioning at home. So that's the first and most important thing. We also know that people who do not have or use air conditioning and have a number of other risk factors are at greater risk of heat-related illness. Those include chronic heart conditions, including heart, kidney, and respiratory disease. Substance use disorders or excessive alcohol consumption place individuals at greater risk. There are multiple mental health conditions that can increase risk, dementia, difficulty with self-care, or any type of cognitive impairment. Those who are isolated, who don't have access to others and perhaps cannot find or have the ability to leave spaces that are uncooled are at greater risk. So that also includes those who have limited mobility. Pregnancy is a risk factor, as well as the use of certain medications. This is because some medications actually interfere with the body's natural ability to self-regulate its temperature. And older adults, as we age, this is also something that happens, is our body's thermal regulation can become impaired, and older adults are also more likely to have multiple of the risk factors that are listed here. So we see greater risk in that population. I wanted to make sure that everybody is aware of the signs of heat stroke as well as heat exhaustion. If somebody is experiencing heat stroke, this is an emergency and you should call 911 immediately. They're listed here. It's sort of one of the things that I think is very important is this idea that when somebody is going into heat stroke, they actually they stop sort of sweating in the way that you might sort of be thinking of. So they have this sort of hot, dry skin, and then a number of other things, difficulty breathing, nausea, vomiting, confusion, hallucinations, or even passing out. Heat exhaustion is sort of on the road to heat stroke. And so we want to be on the lookout for this and immediately help people get into a cooled space, help them hydrate and get cool, and then monitor their condition. And these are similar to the previous slide, but sort of slightly less severe symptoms, including, heavy sweating, muscle cramps, that lightheadedness, and feeling faint. And this can really happen to anybody. It's really important to remember I'm talking a lot about indoor threats and specific conditions that place people at greater risk, but anybody who is exposed to extreme temperatures for a long period of time, particularly if they're doing any sort of strenuous activity, is also going to be at risk. So what can we do to prevent? So I already talked about how air conditioning can save lives. And so what does that really mean, and how do we look at that in our city? So access to air conditioning is a health equity issue in our city. We are fortunate in New York. So I work a lot with colleagues on the West Coast and in San Francisco. For example, they have very, very low coverage of air conditioning. Here in New York City, about 90% of households have air conditioning. However, that can drop as low as 75%. So 1 in 4 homes without air conditioning in our lowest income neighborhoods and in communities of color. So we know that there are those that do not have access to home cooling. So if people have air conditioning, the message that we want to give is, first of all, this is the time to turn it on. In some cases, folks may not use air conditioning regularly for a variety of reasons, but the one that we hear the most is issues with cost of energy, which is a very real problem as well. But if we are in a heat emergency, we want to say this is the time when it is to stay safe. We need to turn on that air conditioner, but we can do that. You can do it at low cool or 78 degrees to stay at a safe temperature, but also help with those bills and also reduce the stress on our electrical grid. For those who don't have air conditioning, we want to encourage them to make a plan and to figure out a place where they can go to get cool. During heat emergencies, there are cooling centers that are open, which are public spaces that have air conditioning. And even up to 2 hours in the cool can, and sort of taking that break can help reduce health risk. And then the other thing is, if folks are working outside, it's really important to take frequent breaks in the air conditioning, and also hydration is important. We also want to make sure that people are dressing for the weather. Don't be putting on lots and lots of hot clothes if you're going to be outside. And then also, I always just like to mention sunscreen, just really one of the best interventions we have. So everybody should wear their sunscreen. Usually when I do this earlier in the summer and in the past, I would now spend some time advocating that you all sign people up who do not have an air conditioner for the Home Energy Assistance Program, which is a benefit program that's done through our New York City Department of Social Services, but it is administered by the state and federally funded. However, the Cooling Assistance Program is now closed. It closed for the second year in a row in the middle of July because of lack of funding. this is in part good news because a huge amount of the people who are receiving the benefit before it closes are here in New York City because of advocacy to get air conditioners for those who need it. But it also means that this is not currently available. So this is a very important resource, and I want to advocate that you all, to the extent that you can, join the city, which has every year for the last 6 years, I think now we're on, advocated to the state that this program be expanded for the cooling assistance. It also operates in the winter months. So, cold weather is obviously also very important. And there are lots of protections and benefits for making sure that individuals have heat in their homes. That's also Home Energy Assistance Program works on that. In the winter months, they also have utility assistance, but in the summer months, they do not. So in the summer months, you can get an air conditioner bought and installed, but there is no support for utility bills. So we are very strongly advocating that this program be expanded for the summer months to both cover utility bills for those in need, as well as have enough funding to remain open and buy air conditioners for those who need them. So I want to speak briefly about power outages and also sort of this idea of how energy insecurity, which is the inability to pay utility bills without sacrificing something else, is really intersects with the dangers of heat. So extreme weather events, particularly heat, put more pressure on the electrical grid, and we know that power outages are more likely, or even sort of controlled reductions in energy, which has happened in the past, which is when the utilities will do sort of brownouts in order to save parts of the grid. This can result in loss of air conditioning. It increases the need for emergency services across the city. It exacerbates chronic conditions, and it's particularly dangerous for those who rely on some type of electric medical equipment. So we really want to advocate that people who do use EME, electrical medical equipment, be prepared and register with the utility, because they have programs to provide support to those individuals in the event of an outage. These are some utility assistance programs that we want to make sure that people are signed up for if they are eligible. I want to emphasize the Con Ed Energy Affordability Program, or EAP. There is a really great program in our city where there is automatic enrollment in this program if individuals receive specific social service benefits. However, that does not apply to people who receive Medicaid, which is a huge population of individuals in our city who would be eligible for lower utility rates, but they aren't going to get them automatically. So they need to go and sign up for them. So if you are servicing or providing services to individuals who receive Medicaid and may not receive other social services, please recommend to them that they check this out. And then I'm going to conclude by talking briefly about community resiliency, which we think is an incredibly important part of, as a city, being prepared, and then also recovery from emergencies like heat. We know from the 1995 Chicago heat wave, there was a study done to look at the recovery at a community level. And what they found was that there were multiple low-income Black communities that had the highest death rates, but then they found several low-income Black communities with the lowest death rates. And when they looked at the differences between these communities, what they found was this social cohesion and this connection. Neighbors knew each other. There was good access to shared spaces and thriving commercial spaces. And there were established, trusted community and faith organizations that helped individuals connect with one another, just like all of you. And so we really want to encourage, in the context of climate threats and specifically heat, building out and building up on those social connections. We encourage everybody to be a buddy and check on their clients, their friends, family, neighbors. Make sure that folks are thinking about the fact that it's hot outside, that they are aware that they're turning on their AC or they have a plan and a place to go get cool. And remembering that sometimes you might be the only person who's checking in, and that's why it's so important. Again, a reminder that fans are not enough. We really want to encourage people to get to that cool space. And if they don't have a cool space, help them find a space where they can go. Encouraging, you know, if they're outside, drink lots of water, dress for the weather, take breaks, and watch out for symptoms and signs of heat illness. I have a bunch of resources here, which I'm not going to dwell on, and we will make sure to send them to all of you. And I really appreciate you all paying attention to this and thinking about how we can all together make the summers as safe as possible for New Yorkers. And I'm happy to answer any questions now or at the end if we're going to do Caleb next. So thank you so much.
Thank you, Cari. Yes, we're going to do Caleb next. So as a reminder, folks, if you can please put your name, affiliation, and your contact information into the chat, that would be great. I also want to take this opportunity to welcome my colleague, Ella Butler, who is the new LES Ready Coordinator. And now, Caleb Smith. Pronouns are they, them, as the Resiliency Coordinator at WEAC for Environmental Justice. They are a great graduate from Columbia University's Master of Public Administration in Environmental Science and Policy. Previously, they served as special assistant to the mayor in Oakland, where they worked to address illegal dumping and helped implement community-led projects to serve local environmental justice communities as part of a citywide plan. Caleb is an avid cyclist, an urban beach bum, and most importantly, he is a community gardener, which means he literally takes care of our earth. And WEAC's mission, as we all know, is to build healthy communities by ensuring that people of color and low-income residents participate meaningfully in the creation of sound and fair environmental health and protection policies and practices. That said, we are very happy to welcome you, Caleb, to the New York City of OAD family.
Thank you so much, Aya. I'll just share my screen. Okay. Can everyone see all right?
Yes.
Okay. Well, I'll go ahead and get started. So I'll briefly give a presentation giving background on WEACT, as well as what we're doing with our Extreme Heat Coalition, how heat disproportionately impacts environmental justice communities, and some of the policies that we're pushing forward now. Okay, so I beat me to the punch there, but this is WEAC's mission statement, and I just want to highlight that 1988 was the culmination of organizing against the North River sewage treatment plant led by Peggy Shepard, Vernice Miller-Travis, and Charles Sutton. The sewage plant that was supposed to be sited on 72nd was booted up to Harlem without any real community engagement, where it functioned without any mitigation of odors or air pollution and caused health problems for residents for up to 3 years. And eventually, Harlem residents banded together to sue the city to mitigate the environmental harm. And part of the settlement funded the formation of WEACT for Environmental Justice. So we really have a long legacy of making sure that communities have the skills and the voice to uplift the concerns in their environment. And for those who aren't familiar, we're active in a variety of different focus areas, but for the purposes of this presentation, I'll be focusing primarily on climate justice and open and green spaces. We are active in a variety of different focus areas at one time, and we're also working at the city, state, and federal level. But for the Extreme Heat Coalition, we're starting, or sorry, for our climate justice in my work, we're starting focusing in urban environments because of the urban heat island effect. So our climate justice platform really is of growing concern and is deeply intertwined with environmental justice, because climate change amplifies extreme weather events that are becoming much more frequent and severe. And it also shines a light on how societal and environmental factors equip or sabotage our ability to endure disasters. And unfortunately, that's why Black residents in New York City have the worst outcomes when it comes to heat health. And so the work that we're doing now is a continuation of our heat, health, and equity campaign. Some folks might be familiar with our cooling center reports and audits from previous years. We also released our extreme heat policy agenda, highlighting a broad range of different strategies to address extreme heat, and also the Climate Ready Uptown Plan. All of this work is focused on community-driven policy advocacy, centering community preparedness, energy security for vulnerable populations, and public cooling amenities. So that's why we launched the Extreme Heat Coalition earlier this year. We really want to build that momentum to make sure that our city and state legislation finally starts to match the grave implications of our rapidly warming climate. And we're focusing our work on major metropolitan areas because residents in large cities will feel the impacts of the heat first and worst due to the urban heat island effect. And right now we have members in New York City and Yonkers, but we're looking to expand to other regions. So our mission is to ensure urban, historically marginalized and vulnerable communities facing extreme heat are protected through policy, adaptation planning, and resilient infrastructure interventions that advance health equity. And these are our current members. So here I wanted to dig a little bit deeper into heat vulnerability. This is, when we're talking about heat vulnerability, we're talking about how likely it is for individuals to face injury, harm, or mortality during periods of hot weather based on social and environmental characteristics. And I wanted to include NOAA's heat index because it helps illustrate the point that there are certain temperatures that there's always going to be risk associated. And so the combination of hot temperatures and high humidity really amplifies the risk for us all. There are certain factors that compromise our ability to withstand these conditions for long periods of time. Aside from medical conditions, medications, and certain stages of life that Cari mentioned, that impact the body's ability to cool off, there are systemic factors that result in disproportionate outcomes for certain groups of people. For example, one that always comes back up in these spaces is redlining. And for folks who aren't familiar, this was put forward by the Homeowners Loan Corporation, which systemically disinvested in areas where there were high concentrations of people that were deemed financially risky, but the quiet part that they're not saying is they're considering people of color and certain immigrant groups as undesirable. So this had the effect of making sure that residents couldn't get a loan to buy a home and develop generational wealth, but it also depressed economic development for businesses. And even though this ended 50 years ago and started in the 1930s, it left a lasting impact on our built environment across the country. And as a result, the health and resilience of communities that were targeted were strategically disempowered. So we see that legacy in a number of different ways that we experience environmental racism. First, I'll start with inequitable distribution of green spaces and trees. A Trust for Public Land study noted that the average park size in New York City in predominantly Black neighborhoods is approximately quarter the size of that of predominantly white neighborhoods. And this is important because parks and other green spaces are an asset to cooling for everyone, regardless of housing or socioeconomic status. And because loans are diverted from these areas, when we're talking about working class wages, it's related because there are fewer high quality job opportunities in neighborhoods of communities of color. Now, higher poverty rates in certain areas is strongly correlated to lack of access to air conditioning, which, as Cari mentioned, is a primary predictor of heat stress and heat mortality. And then in terms of housing stock quality, the sort of old, poorly maintained buildings that are prevalent in certain parts of the city are more likely to have issues with pests, mold, and other irritants that exacerbate respiratory conditions. And they are also prone to leaks and poor insulation, making it harder to prevent apartments from heating up. And even with air conditioning, the air conditioning units have to work much harder to cool down the space. So some compounding factors for extreme heat. Harlem is a great example, unfortunately, of how multiple polluting facilities clustered in communities of color result in cumulative climate risks. When these areas are exposed to extreme heat, air quality issues worsen. For example, heat waves speed up the production of ground level ozone because it comes from chemical reactions between nitrous oxides and pollutants that get trapped in urban areas from sources like vehicles, power plants, industrial boilers, refineries, chemical plants, when it reacts with sunlight. And also particulate matter air pollution from multiple sources also becomes an even more serious threat during heat events, because both particulate matter air pollution and ozone aggravate existing respiratory and cardiovascular conditions. So when it's hot and humid out, it's already harder for the body to regulate temperature and for the lungs to function. Like you consider that people are exposed to threat amplifiers at home and outdoors in neighborhoods like Mott Haven in the South Bronx, where asthma hospitalizations are the highest in the city. You begin to really recognize the severe burden put on environmental justice communities. So that's why we're still in the early stages of the Extreme Heat Coalition, but we do have a slate of 3 policy solutions that we're currently campaigning for now. The first is the Urban Forest Master Plan. This is an introduction 1065-2023. This bill would require interagency coordination across city, state, and non-governmental stakeholders to create an urban forest master plan, basically making sure that there is a long-term, comprehensive and equitable plan for the city's urban forests, and recognizing that trees are a vital piece of infrastructure to deal with cooling for sure, but also a myriad of other resilience and health benefits, supporting flood mitigation. And there's plenty of other mental health benefits, reducing air quality impacts. So this is something that we're really strong advocates for. And the bill currently has provisions to reach an urban canopy coverage goal of 30%, establishing metrics to expand and protect the urban forest, and to require the collection of LiDAR data, that's light detection and ranging. So this is just a technology that really gets fine-tuned, detailed information about land cover to monitor effectiveness of the plan. And it would be updated every 5 years. But we have been alongside several other organizations pushing for amendments to give that 30% canopy cover goal a time boundary or a time goal. So we want 30% by 2035. We're currently sitting at 22% urban canopy cover. But we also want to make sure that there are criteria to prioritize climate, health, and environmental justice considerations in the rollout of this plan, as well as, sorry, I lost my train of thought for a moment.
That's okay, take your time.
Well, I'll continue, but I'll be sure to plug it if I can remember. And also this means that our Parks Department needs to be fully funded, and folks might know that the Adams administration on the campaign trail had originally said that they would allocate 1% towards the city parks budget, but currently it's far below that. And so 1% is the minimum that parks would need to be able to keep up this space of expansion and preservation for the urban forest. And then the next policy solution that I'll get into is codifying cooling centers. As Cari mentioned, this is such an important resource during heat waves for folks who don't have access to air conditioning. But as it stands, currently the New York City Office of Emergency Management doesn't have a budget to run this program. It's mostly partnered organizations like senior centers, libraries, recreation centers that are just operating under normal circumstances, normal hours. And that results in serious gaps in coverage because obviously heat waves don't abide by business hours. If there are heat wave events that are happening on the weekend, the comptroller's office released a report, overheated and underserved, expanding cooling center access, found that neighborhoods home to predominantly people of color have the fewest cooling centers per 100,000 people. And I believe the figure was about 50% of cooling center locations are closed on Saturdays and 83% closed on Sundays. So this is a serious risk that we run without having adequate coverage of cooling centers. So we are advocating for cooling centers to be codified into the city charter so that they can be cemented as part of our emergency operations and receive the necessary funding to make sure that there's robust community outreach, as well as protection for power outages, that there's programming available about heat health, and just to support community cohesion and draw people to the cooling centers. And then lastly, I'll discuss the maximum indoor temperature. So indoor temperatures pose a really high risk for heat mortality because they stay high and stable for so long. And as it stands, the burden of cooling falls only on tenants, which we know has deadly outcomes, with 350 New Yorkers dying per year from heat related illness. And so with the maximum indoor temperature, we are advocating to City Council to have provisions in our building code to make sure that heat does not exceed a certain temperature. We understand that there's momentum and support for this, but we want to get ahead of the conversation and guide strategic thinking to make sure that this doesn't result in exacerbating energy burden, and that it doesn't drive ability for folks to stay in their housing. So these are a slate of different policy recommendations that cover both public and private spaces in terms of cooling. And I'll put a link, or I have a couple links that I'll put in the chat in order to share the action networks that we've put together to show City Council that we want urgent action on these issues. So I'll stop screen sharing now. Thanks, everyone. Oh, sorry, I think you're on mute.
I am on mute, and I thank you very much for that presentation, and I'm going to turn it over to Zach for Q&A.
Yeah, thanks so much to Caleb and to Cari for your presentations, but also for being willing to take a couple questions. I think we have time for maybe one or two. I'd ask if someone does have a question, if you can just throw your Zoom hand up just so we can see that. Janine, go ahead. You're on mute, Janine.
I got it. I take a couple of seconds to turned everything off. Question. I went away in April to the Caribbean, and I was there for 10 days. I broke out in a heat rash. Never ever happened to me before. It wasn't like the heat and humidity. It was Aruba. So it was pretty much 85 every day, fantastic weather. Is there something that happens? I mean, age-wise, I'm 57. I don't know. Is there something that happens that makes you more intolerant to the heat over an extended period of time? I was clad, so I wasn't out in bathing suit and shorts or whatever. Like 3/4 of my body is covered. So I'm just curious, is there any knowledge that can be shared about that? I've never had it in New York, never. I lived in New York my whole life.
So I will be clear that I am not a clinician, But the couple of pieces of information that I would just share and then recommend that you chat with your provider are, one, it is true, as I mentioned, that as we get older, our bodies can, like our body's abilities to thermoregulate specifically can change. I don't know whether that would manifest in some type of rash. The other thing that I will also mention is that sunscreens, it is possible over time to develop allergies to some of the chemicals in sunscreens, and those can cause rashes sometimes. So that's also a possibility. So even though you've used the sunscreen for however long, then you might that's also a possible thing. But I think big picture, it is true that as we age, there are ways in which our bodies become less tolerant or could have more difficulty outside.
Thank you.
And then I see Beth had a hand up.
Yeah, thank you. Great presentations and crucial information. I have a question about heat islands and emergency declarations. The map showed very clearly things like Central Brooklyn is a heat island, East Flatbush neighborhood specifically. But a heat emergency declaration is dependent not on those fine-grained data, which we have, but on the general New York City. And we're talking about neighborhoods that are 10 degrees hotter than the rest of New York City. And also, as you pointed out, those hot buildings can stay hot for 3 additional days. So is there a way to drill down for heat emergencies to neighborhood level? As Caleb knows, the neighborhoods, the underserved neighborhoods, Black and brown people, are also huge heat islands. And again, a general declaration based on New York City's general temperature sort of skips over the most vulnerable populations where we have emergencies when other people don't. I have no idea who can answer that question. But that's a concern.
Caleb, do you
Yeah,
want to?
I can try to start. So I think a big part of that is getting additional funding for more surface temperature monitoring and diversifying the areas where that information is collected, as opposed to relying on what the temperature is in Central Park, which is of course going to be a lot cooler than a lot of this, like the city in general. And also another thing that we're really going to be pushing forward is advanced heat advisory, as opposed to sort of the after the fact communication that goes out. And this also ties in with our cooling center advocacy, because with a set budget for the cooling center, it will help for the communication not to be only during a heat event, but instead allow for the cooling center map to be available before an activation. So yeah, a big part of it is funding, and we're going to continue to push for that both at the city and state level.
Yeah, when you're pushing for the funding for the minimum temperature, indoor temperature, or the maximum indoor temperature, the wiring of older buildings in New York City is an issue. One of the reasons the South Bronx went up in flames is because everybody turned on their air conditioner in buildings that were wired for a radio and a light bulb. And so mandating maximum indoor temperatures, I think, is a very good idea, but there has to be funding for people to upgrade their wiring as well. And by the way, I'm going to finish. The methods that you want to use to reduce heat, tree planting, open spaces, are also great ways to control urban flooding. So there is a crossover there for more partnerships.
Absolutely. And with regard to, like, again, the strain on the grid and the wiring in buildings, one thing that we want to be really thoughtful about is not to be too prescriptive in terms of the ways that buildings can meet that maximum temperature, because I think it will take a variety of different mechanisms. Of course, air conditioning is it's like the fastest way for us to approach that now, because it can help reduce the humidity, but it's also not the most sustainable long term. So we don't want it to be, you know, saying that that is the only way that we should move forward. But it is definitely a part of the way to make sure that we are reducing heat mortality. And then Cari, I don't know if you have anything to add to that.
I mean, I see that we're right at time, so I will just, you know, I think everything that you shared, Caleb, makes a lot of sense. And the one thing that I would add is that, you know, when we think specifically about calling emergencies, I think one of the things that we're thinking a lot about is the danger of message fatigue. So we're going to have more and more emergencies. And if we also start diversifying and saying, oh, in this neighborhood, we're having a heat emergency today, and in this neighborhood, it's tomorrow, then what I would rather do is have everybody understand and be educating around the importance of staying safe in summer heat, and then think how we can strategically use sort of those emergency calls in a way that will not result in people slowly tuning them out, which is one of the things that we're already finding. And I don't have solutions to that. I think this is a challenge and a balance. So just something to think about as well.
Thanks so much to Caleb and to Cari again. Thanks to you all for joining. I'll take Beth's reference to urban flooding as a good segue to tell you that next month, being National Preparedness Month, we're joining New York Disaster Interfaith Services and the Mayor's Office Center for Faith-Based and Community Partnerships to have a preparedness summit on September 13th. That'll be from 8:30 to 2:30 at the Salvation Army on West 14th Street, where we will have guests from the New York City faith-based and community organization networks talking about flooding, urban flooding. I was in a meeting with emergency management just yesterday where there was a stat in one slide that said 65% of deaths from coastal storms are now from urban flooding and not from storm surge, which is something we definitely learned from our experience with Ida. So another important topic to discuss. So I hope you all can join us actually in person this time. Lunch will be served, I promise. So please plan to join that one. Thanks so much again to Caleb and Cari. Thanks all for joining us. Please plan to join us in September. We'll see you there.
Thank you all.
Thank
feel free to
you.
reach out if you have any other questions or if you're interested in the Extreme Heat Coalition.
Thanks. Bye-bye.
Thank you all.
Bye.